Thanks, KG, for your introductory remark. And also thanks for the organizer for inviting me to speak before this important crowd. You know, I was exposed to these issues since my posting in Geneva, because I follow the issues of H5N1. Start when this outbreak in 1998 to 2003 in southern China, yeah, and then after that, quickly spread out to Southeast Asia. First being detected in domestic poultry in Indonesia in the year 2003. It was not until July 2005, however, that it was first diagnosed in human, spreading swiftly from Western Java. Java is one island of Indonesia. Indonesia have 17,000 islands. So to all part of archipelago. Yeah. Besides its devastating effect on domestic and wild bird population, these in turn had a fatal impact on human, and through April 2009, there were 115 deaths from 141 confirmed human cases, the largest, victims in the world at that period of time. In this context, Indonesia mass media and members of Indonesia House of Representatives had begun to question the ability of the Ministry of Health to contain the bird flu. Since 1998, the politics in Indonesia is very open. It's like in the United States. You know, blaming president, blaming ministry are actually daily coverage in the newspaper. Yeah. So at this point, it's perhaps worth reflecting the Global Influenza Surveillance Network, GISN, that had been established in 1952. GISN regulated that the affected countries send samples of the virus to the collaborating center laboratories. Indonesia, since the beginning, complied fully with the GISN regulation. Never reject any sending of the virus. After the laboratory had identified the candidate vaccine virus, or CVV, and then it would disseminate the findings to the pharmaceutical companies to enable them to actually produce a vaccine to later be made available on the market for use in containing disease. Fine, in theory, this is perfect. But in actual practice, Indonesia had a bitter experience when searching the market for H5N1 vaccine following the cluster of cases around the Lake Toba and Sumatra, because the cases in Lake Toba, the uncle got it, the nephew got it, the brothers also got it. So it's such kind of like making people panic, whether the transmission is already human to human or is it still from animal to human. Yeah, so this make, politicians in the parliaments eager to attack the government, yeah, particularly the Ministry of Health. So we decided to send a delegation to Geneva, led by our Minister of Health, Minister Supari. We are seeking for, stockpile, to address this problem, a stockpile of vaccine. And then at that time, the Director General of WHO was Margaret Chan. She's a nice lady. She was very effective in addressing the problems of SARS in Hong Kong. So she listened carefully about our complaint. Yeah, we thought, Madam Margaret Chan, this organization called World Health Organization. This is not World Virology Organization. So the task is not only try to put emphasis on surveillance, but we have to have also ways to address, to respond to the disease. not only to find out the disease. So, Madam Margaret Chan said that, you know, we are dictated by the collective wish of member state. So, and then she informed us that there is antiviral called Tamiflu. It's effective for addressing this problem, Madam Minister. And then please go to the producer because we don't have any in WHO. So we went to Rose to seek for, you know, availability to buy. And then the company said that we are very pleased to have Minister of Indonesia interested in our products. But I would like to inform you that Indonesia should wait for 2 years to get this Tamiflu. Because all products of Tamiflu were sold out based on the advance purchase agreement. You know, so based on it, we have meeting with the minister in my office. So what does Director General means that we are dictated by a member state? So I told the ministers that this means that if you are interested to change or to have something discussed or decided by the ministers, by the WHO, you have to have resolution. Yeah, and then the resolution will be a guidance of the Director General to do something as a follow-up of it. So by then, we decide that this current system, the GISN, is very good in terms of surveillance, because we are supposed to submit the time is up already. So maybe I answer later on, or yeah? Yeah, okay.
No, thanks, Makrim, for laying the groundwork. So